Hi everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today I would like to share you one of our patients that we did in 2022. I would like to mention and explain some of the things that we did with him. So let's start quickly with his file first. Our patient is right now 37 years old, but the results that I'm showing you right now is from 2022, and I will be telling about the 1-year result from patients to you. Let's jump into our clinic photos. Okay, so it's very similar. You see that the frontal hairs are very miniaturized. It has a better light. That's the reason it's very noticeable actually. But I think I asked the patient if he used any medication just before coming to us, and he said that he used minoxidil, but because of the allergical reaction, he stopped after a month. So he has not been on medication for hair loss. We want always patients to use these kind of medications just before coming to Turkey, before coming to clinic. So we started immediately after the medication, after their transplantation, some medications to him. His donor area is very good. His frontal area needed some restoration, and we planned his surgery. Now I would like to show you some photos that we created his hairline, the desired hairline that he wished, and also the ones that we recommend as well. We didn't lower too much, but yes, from his actual point, we just lower his hairline around 7 to 8 centimeter from the glabella, which is very normal and natural for the proportion actually. It may look some straightness to you or straight hairline, but actually it's not. It's going a little up in the temple parts. So the front is planned with the maximum density in that area. There are some hairs. Sometimes the patient's asking us what do we do with the existing hairs in that area. Each hair is important for us, so we need to keep those hairs. If we keep those existing hairs, we reduce the number that we're gonna implant on this area. Sometimes, even for a normal guy who is not having a hair loss problem, if we expand the area by giving some fluid, we separate those hairs from each other and there is a space. If we can penetrate into those space, we can increase it. And so for everyone, increasing density is possible if he needs some density increase. We extracted 3,600 grafts with him, which is very normal for that kind of area, because per centimeter square we are using 50, sometimes 55 follicles per centimeter square, and he has almost more than 50 centimeter square frontal area. So these numbers are very normal to restore for those patients. Yes, if we don't have such numbers, we are decreasing those numbers to those densities to the number that we had. But in this scenario, we have enough graft number. Okay, let's jump into the first month. In the first month, we usually don't see anything. With finasteride usage, minoxidil usage, yes, we see some improvement at that time because these medications are very helpful for the shock loss period. But if the patient is just starting newly or wasn't using before, at that time we may see the shock loss. After the 3rd or 4th week, we experience some shock loss with the patients because those hairs, which is extracted from the donor area and implanted to the recipient area, has no direct vascularization at that time. That's the reason it's going in a sleeping mode and the hairs is not growing because it lacks of energy and it doesn't want to, I think, spend his whole energy for growing of a new hair. That's the reason until the 3rd month we don't expect a growth. With most of the patients, sometimes it has different varieties, but for this patient, which is a normal thing, he has some grown hair. Mostly it is shock lost. Okay, 3rd month photo. At this month we may see some growth, but it is not a must. Sometimes it delays up to 4th, or sometimes it delays up to more months. But here, yes, it is as expected. We don't see too much. Nearly some hairs are growing. His existing hairs is growing too, but in the other scenarios, no, not too much. Donor area is completely healed. There is no mark of any hair transplantation or extraction point. Looks good. Okay, so 6 months. Okay, at 6 months, I think it's a little bit critical period because we may see the half of the result sometimes, or sometimes we may even see 70% or 80% of the result that we want to see in the end. But for this patient, of course, it is grown in the frontal part. In some areas, sometimes it is not synchronized, so you don't see the exact result in all areas. So don't compare it with yourself, even in the different areas, or with someone else, because everything is very different. Okay, and now it's the 9th month. Okay, so in the 9th month, yeah, he has a longer hair, he has a good style, he's looking good, he was handsome already, he's much more right now, I think. His donor area already healed, there's no problems in the sides. Here, the front is the first important thing, I think. With most of the hair transplantations, you need to be careful by seeing or choosing a clinic that if he is really noticeable or not. I think that's the most important thing. If from a proper distance, like 1 meter, 2 meter, if you can't notice the hair transplantation, that means it's a good work, whether we are doing or other clinics. But we are also seeing so many cases in the public spaces, and at that time, even my friends will say, oh, this is a hair transplantation. If you're seeing something, that's not a good right thing, I think. Donor area is very good here. Perfect, nothing. And his front till, I think we did already the mid scalp as well, so it's full. It's very full, which is very good, I think. So in the 9th-month photo, we are seeing a wonderful result of this patient. I think a patient should be happy. We are also seeing his result, and we are happy too. So thank you for watching us. And if you have still questions, please write on the comments below, and we're gonna answer them. Thank you.